What do you actually feel in a deep plane face and neck lift performed under local anesthesia? Let's take a beach walk. When a patient sees me in consultation, they're in one of two groups. Either they seek me out purely because I'm doing this under local and they say I would never ever consider doing this procedure any other way because I am not being put to sleep for that amount of time. Cool. The other half of patients say, I love your results, but I'm a little concerned about that local thing. This beach walk's for you. So what you can actually expect to feel during this procedure. First off, you come in the morning and you will take your medications. A good dose of Valium, some antibiotics, some other medications that are non-narcotic that help the Valium work better. And then we will give those medications 30, 45 minutes to work. During that time, I will color on you, make sure you are in a good place and comfortable. And at that point, we will take you back to the surgery suite where you will get some happy gas, nitrous. And that is patient-controlled device where as deep a breath you take, that's how much gas you get. And so you control it. It is extremely safe. It is very short acting, and it just lasts long enough for me to do those teeny tiny little pokes. And those teeny tiny little pokes I do with a Botox needle. So if you had nothing on board, they would feel about like having a Botox or filler poke performed around your ears and under your chin. I would have to say the vast majority of my patients have at some point had Botox or filler performed with no Valium and no happy gas and did just fine. And generally patients say this is not a big deal if they even remember it at all. With the mix of oral sedation I'm using, I would say about half my patients say they had no recollection of the whole day, which is great. And the other half of patients say, I remember we talked about something and I remember you made me get up and go to the bathroom once and that's all I remember. And that's also okay. You are not acutely aware of everything that is going on during this procedure, and we make sure you are comfortable and above all make sure that nothing is painful. And only those tiny little pokes at the beginning of the procedure could potentially be something that you actually feel as pain. Beyond that, my numbing medication takes over. And this is an important aside. Those injections do not sting. I am meticulous in how I mix that numbing medication. I've had patients have bad experiences with dentists and Mohs surgeons where they had extraordinarily painful injections, and that's because of how the local was mixed. And as somebody who does local day in and day out, I mix it in such a way that it will not be terribly stingy and should be relatively comfortable on the order of a Botox or filler. Number two thing you may feel is some mild pressure or tugging. So during the deep plane facelift, we have a hand resting on your cheek just to keep you in the position we want you to be. You may feel some mild tugging or pulling during the surgery, but you will not have any idea what's really going on. And these are not painful. That's the important part. There's nothing painful in this. It's just some weird, mild feelings that I've had patients say it's kind of like a weird facial. Number three, you may hear some noises. You will hear a buzzing noise intermittently, which is my cautery. You may hear some rustling noises which are related to what I'm doing around your ear and that bone conduction. Again, these are sounds that are not accompanied with any real sensation. And so generally patients are comfortable and not bothered by these. You do not see anything bloody. You are not seeing surgical instruments. You just know that somebody is working on you and you are not feeling any pain. And number three, you are not smelling burning flesh the whole procedure. So this one's interesting, and I've been asked about it multiple times because a typical surgical instrument is a monopolar cautery or Bove electrocautery, and it is a device that cuts and cauterizes at the same time. It is very commonly used in surgical procedures to allow for quick dissection, and it makes it so there's no bleeding. Cool. It has way too much heat dispersion to be used in an awake patient. So I do not have a monopolar cautery on my field. You will not be smelling burning flesh. I only use bipolar electrocautery, which looks like a tweezer, and there's only cautery performed in a very tiny area in between the tips. I do the rest of my dissection in the least traumatic, most precise way with no involved cautery, so that there is less heat damage, there is less pain, and I think that leads to a result with a lot less swelling or bruising. In summary, deep plane face and neck lift under local should be a fairly boring experience, and the vast majority of my patients tell me, wow, that was a lot easier than I expected. I think this whole concept of putting patients to sleep came from this belief that patients can't handle it, that women need to be put to sleep so that they don't have to tolerate anything. And what I've found is my patients are tough. My patients get Botox and fillers every few months. They've had babies. They've had real surgeries. They've had hysterectomies and mastectomies. And so this is something that isn't even on the same scale. And so I firmly believe deep plane face and neck lift, this cosmetic procedure, should be done in the safest and easiest way possible, and I can 100% make it comfortable for you. So thank you for coming with me on this beach walk. If you have any other topics you'd like to hear me cover on one of these beach walks, please leave them in the comments below. Thanks.